So my name is Nguyen, but I go by Blake. I am an MD and a DDS. So my track is actually a little bit different. So I actually started out in medicine first. So I went to medical school at UT Southwestern. When I was in medical school, I just didn't gravitate to any particular part of medicine. And that's when I actually stumbled upon oral surgery. And the people that introduced me to oral surgery are my two partners, Dr. Yates and Dr. Brokoff. And the more I explore about oral surgery, the more I fell in love with it. You know, I think the biggest thing is that when you have patients who come in and they're like, you know, I lost all my teeth due to trauma or due to other reasons, and you know, they're like, you know, I can't chew, I can't eat, I can't function. You know, back in the day it was hard because there isn't a lot of solutions. You know, you were talking about the 90s, but now we can give them back something they're missing and giving them that quality of life. And to be honest with you, when I got into the profession, I was like, oh, I'm going to try to do big surgery. But in reality, it's like the more I practice, the more I gravitate towards, you know, dental-alveolar implant dentistry, basically being able to restore someone's ability to chew, to bite, to function. That to me is very important. A lot of people don't know that we are dual trained, right? So, or, you know, the scope of practice is, like we say, we cover anything from the neck up. So when a patient comes into here, they think that all we operate on is teeth, just literally within the mouth. But then when we start talking to them and say, hey, you know, we also do functional rhinoplasty, which is actually augmenting the nose so that way the patient can breathe better. Or we can do facial augmentation to change someone's appearance, right? So most of the time when we have that conversation and people are just like, wow, it's not only in the mouth, but it's actually the overall from the neck up, basically. I like to travel. So I travel a lot. Like, so if I'm not on call or if I'm not being bound here, you'll see me on weekends. I'll fly to, you know, Houston, San Antonio, you know, any places that are just boom, boom, a quick 3-day weekend trip. I have 2 dogs, so both of they are a beast, you know, having to take care of them, but they're very enjoyable, you know, coming home and having someone, you know, like, you know, they greet you. And then for me, if I'm not traveling, I'm actually, I like to do gardening and stuff like that. I think the biggest thing is that our group is there, like there isn't anything that isn't covered by one of the 7 of us. We, like I say, we have a full scope practice here. So any procedures that people think of or can't find like a doctor that provide care, just they can always reach out to us and we'll be able to guide them, or, you know, within our practice, most likely they're one of us that take care of that.